name is Karen Zhang, and I'm excited to be presenting to you today on neonatal mortality mitigation in developing countries. So, a little bit about me. I am an incoming senior at Merced High School, and I am part of HOSA, Science Club Leadership, Coding Club, Cross Country, and Scouting. Last year, I was a part of Seattle Children's Research Training Program, and this upcoming summer, I am a Stanford STEM intern. I'm interested in public health, biology, and history, and I have a future goal of becoming a physician with a focus on cross-cultural healthcare. So, introduction. The objective of this presentation is to enhance the understanding of neonatal mortality and its impacts on a global scale, and also discuss evidence-based approaches on reducing neonatal mortality. Neonatal mortality is the number of deaths from birth to the first days of life per 1,000 live births. And the time after birth is often the most vulnerable for a child, so it's imperative to maximize positive healthcare outcomes during childbirth and the week after. And high quality, universal maternal and newborn healthcare should not be a privilege, but it should be a right of every child and pregnant woman. So let's look at the worldwide prevalence. Globally, 2.3 million children died in the first month of life in 2021, and approximately 6,400 neonatal deaths occur every day. And the World Health Organization estimates that 40 to 60% of these deaths are preventable. Also, it's notable to recognize that many neonatal deaths are unrecorded in any formal registration system, which means that the actual number is likely much higher than what is recorded. Also, advancements have been made to improve maternal and child survival in recent years. However, neonatal mortality has declined at a slower rate, and progress is uneven and remains unacceptably high in many parts of the world. High-income countries have a relatively low mortality rate compared to low-income and middle-income countries. The areas that are most susceptible to a high neonatal mortality rate are South Asia and Africa. Some of the challenges that developing countries face is that there's poor pregnancy outcomes for women, largely due to low literacy, poor nutrition, lack of economic autonomy, and social inequality. So, some primary causes of neonatal mortality. Preterm birth is the leading cause, and it's when a baby is born too early before the 37 weeks of pregnancy has been completed. And it can be caused by inadequate prenatal care, infections such as malaria, HIV, high blood pressure, being obese or underweight, and substance abuse. Another issue is intrapartum related complications, specifically asphyxia or the lack of blood flow or gas exchange in the fetus. Also, infections and birth defects such as sepsis, rubella, hepatitis B are also are also of concern. And as you can see in this pie chart, preterm births comprise of 35% of these neonatal deaths. So how do we solve that? So some interventions are antenatal steroids from 24 to 34 weeks only if the gestational age can be determined, because if not, it could be of harm to the pregnant mother. Also, antibiotics for preterm, pre-labor rupture of the membrane are also a sort of intervention, but it's contested because of the risk of antibiotic resistance. Another method is kangaroo mother care, which is skin-to-skin contact with the mother and the baby, and this is also an effective way of reducing complications further down the line. And another technology is bubble continuous pressure airway ventilation, or CPAP. And it's a low-tech but high-yield technology, and it's non-invasive ventilation strategy for newborns that creates bubbles that produce airway pressure oscillations. In Ghana, RCT saw a mean decrease in risk reduction of 16 breaths per minute in infants that were less than 30 months old, and Malawi observation study also saw a survival rate of 82% in HIV positive children. So this is a very effective measure. All right. So sepsis intervention. Breastfeeding is the most important intervention. There's a molecule called epidermal growth factor in breast milk that activates receptors in the intestinal cell that keeps dangerous gut bacteria from migrating into the bloodstream, where microbes can prompt sepsis. And the World Health Organization recommended breastfeeding practices would prevent over 6,000 neonatal deaths a day. And delayed breastfeeding initiation by even 24 hours increases the risk of neonatal death by 2.4 times and fourfold if delayed until 7 days of life. Other interventions include treatment of maternal infections such as UTI, STI, and malaria, and hygienic care, applying chlorhexidine gel into the umbilical stump of a newborn to prevent further infection. So, another issue is birth asphyxia, and one intervention could be basic neonatal resuscitation, which would avert as many as 30% of immediate neonatal deaths. And essential interventions such as drying, warmth, clearing the airway, and air stimulation are key. There are currently two global resources available: essential newborn care and helping babies breathe. There's a lack of availability of appropriate and easily cleaned equipment, and supplies is a big barrier. Let's talk about some general intervention techniques. First off, health education to educate people on the benefits of facility delivery and the importance of hygiene and micronutrients is key. A 2008 study in Nepal showed that washing hands significantly reduced the risk of death for infants by 44% if mothers wash their hands prior to handling their infant. Also, a study in China showed the prevention of neurotube defects with an increase in prenatal folic acid intake. Overall, awareness on the community and government levels is crucial in order to educate mothers and their families about the measures that they can take to prevent um, neonatal mortality. Also, it's important to note that prevention strategies are region specific based on different social and cultural backgrounds, and what might work in one country might not work for another. In conclusion, millions of infants are still at risk from dying from preventable causes, and neonatal survival must be at the heart of the global development agenda. And progress is possible through systematic intervention methods and notably legislation and education. And so here are some of my references. And I would like to thank the organizers of the Global Health Leaders Conference at Johns Hopkins University for giving me this opportunity. I would also like to thank the attendees for listening to this presentation, and I'd also like to thank my family for supporting me. If you have any questions, please contact me at karenzhang@gmail.com. And thank you so much for listening, and have a wonderful day.